Welcome to Nat Rev MD, a podcast where we share tips on optimizing medical billing and improving practice efficiency so you can have the business of your dreams. I'm your host, Dr. Heather Signorelli, founder of Nat Rev MD. Let's get started. All right. Hi, guys. Welcome to the Nat Rev MD podcast, where we help private practices increase revenue, streamline operations, and then also just create a place where people like to be a part of. I'm Dr. Heather Signorelli, physician and founder of Nat Rev MD. Today, I am joined by someone who I truly admire, who is working hard in a very thriving practice, Marissa, who is the office manager at Emerald Coast. At Emerald Coast, and have her here just to share about the challenges you see in practices, the wins you've had, maybe some stories about things that make your skin kind of crawl or make you stay up at night, just to talk real about the challenges you see in running a large practice. So thank you, Marissa, for coming and being on.
Yeah, absolutely. Thank you for asking.
Well, okay, so give me the scoop. Like, how did you end up and get into your role that you have now? Like, what's your background?
So I started in 2008. I started in medical records. I was just looking for a job. And so I started at an orthopedic practice locally in Pensacola. I did some steady increases. I did 4.5 years there. So 1 year, the first year I was a medical records technician. Then I moved on to scheduling. And then the last 2.5 years that I was there, I was the administrative assistant to the administrator. At that time, they were being bought out by one of our local hospitals. I had the opportunity to move on to operations support, which is the EMR side of things, the training of the MDs coming in, the employees, things like that. So when I made that transition, then I was there for about 1.5 years. They did big budget cuts to our department. We lost our entire support team. And so then that actually led me into a primary care office position. I mean, at that point, I had already had one of my children, actually 2 of my kids, and it was just a front desk receptionist position. I was there for about 4 years. That was primary care. And then after that, he ended up, the physician, he was just one single doctor. He ended up having a medical issue that forced him to close his practice. So then I was once again trying to find another job. Still no managerial experience at this point. And so I ended up at Hinghole Dermatology. I was there for 4.5 years. And about 6 months into starting there, I was just doing scheduling, front desk, reception. They asked me if I wanted to be the office manager for their general dermatology department. And I had no experience in managing anybody, let alone,
Multiple things.
A group of 10 to 12 employees. But it wasn't a clinical, it was non-clinical. It was, medical reception, things like that. And so I took on that role and I had on-the-job training. And so for 3 of those years, I did management. I was moved over to different locations, back and forth from Pensacola to Gulf Breeze. That's actually how I got to know Dr. Gibson, who works here now, because she shared, when she worked for Baptist, she worked there as well.
Got it.
We shared an office. But it came a point where the dermatology office, he actually sold to a corporation. And that corporation, actually, I thought the corporation brought more order, brought better opportunities for our employees. But the management that was in place that happened to also be my management directly did not feel that they needed to kind of follow the rules, jump on board. There was a lot of resistance to change. And I really felt like at that point, this is not a healthy environment for me any longer. And so I reached out and I really, really continued my journey trying to find a management position. And then it took me a while. Like, it really took me a long time. And I'll tell you why it took me a long time. Regardless, I did not have a bachelor's degree in management.
Okay.
I didn't have a bachelor's degree at all. So that always kind of stopped me from being able to obtain just on experience alone, just because I didn't have that physical piece of paper.
Yeah.
And so when I saw that the position was being hired for here, of course, I met with Jennifer, and Dr. Gotthelf at the time was the owner. And so I got the job, and I actually just graduated in May with my BA. So
Congrats.
now I have the paper, but I will say that working in specialty offices really has helped me understand the importance of the core, which is primary care. Just knowing how those offices work has really, really helped lead and guide and help the employees think like, we are the center for this patient care. It's very important that we have everything that we need for that. So, yep, that's just kind of a little bit how I ended up here. And then, of course, I guess Dr. Health liked me and didn't want to get rid of me. So I'm still here.
Well, and, we've known Jennifer and James, for, I guess, 4 years now, or ish, 3.5. Good people. And it just seems like your practice exudes good culture. Like whenever we have an issue, and, issues are always going to happen. And I talk about this in a lot of podcasts, right? Like issues in an office or any place of work or any business are going to come up. And so I think it comes down to how do you communicate those things? How do you retrain people? How do you deal with turnover and then retraining those people? And so obviously you've set a really good culture, a really good place. So talk to me a little bit about, kind of your staff today in the office, and maybe a little bit about what are some of the strategies you use to set that culture? Is it team huddles? Is it regular one-on-ones, or is it something completely different?
So, before I started there, I thrive on structure. I thrive on being held accountable. I know some people aren't like that. The culture we have here, and we're lucky that we have such a I say a short connection, but it doesn't take us long. Like we don't have to travel to go and meet one-on-one with our employees. If I need to speak with them, they are there, every day. I could just pull them aside, or we can come in the office, quick chat. I think it's important in order for your work culture, your environment in your clinic, they have to feel like they are making a difference and that their presence is noticed. I try to think back places when I walked into my work, people didn't even know I was there sometimes. It's just, even if the highs and the buys and how are you today?
Yeah.
Not just listening to answer, but really listening to what's going on. I mean, they are the point of contact. They are the first, if there's an issue with protocol or procedure or how we're doing something, it's important that a manager knows exactly what's going on, not to fix it, but to hear from those employees, like, I'm telling you, this is a concern, this is a problem. I think a lot of managers these days are just worried about, well, let's just get the job done.
Yeah.
No, let's get it done right, learn from it, move on, and apply it. Because if you don't stop and do all of those steps and really make your employees feel like they are contributing value to a patient, to their coworkers, to even the providers that are here, they're not going to want to perform for you. They have to be passionate. And sometimes you have to bring out that passion. You have to remind them why they chose medicine.
Totally.
And that's just something from a management perspective. You don't have the ability to be like, oh, it's just another day at work. No, you need to be intentional with what you do, because they are looking for leadership. And so here we try to make it a culture about family. We don't want to impose on their personal matters, but we really want them to know that when they walk through that door, they're not just a body. They're not just a robot. They're not just doing a job for a paycheck, that their main focus is making a difference in whoever they touch with their hands, or whoever, whatever issue they're talking to about a patient on the phone. And we all know primary care is, it's the core, but it's also our patients.
A lot of work.
And sometimes they honestly are alone and they just want to talk to you about what they ate for lunch, or what soap opera they watched yesterday, because they don't have anybody. And, we try really, really hard. I try to put that into the clinical staff as well as the front desk, that you always want to think about how you would feel in their shoes.
Yeah.
I think if you come from that mindset, it really can change how you react to the situation, how the care is that you're giving, how the patient is receiving that care. And I really think that that's really what holds us together. I mean, we like to have fun too. I mean, we don't take ourselves too seriously. I really like for the ladies to be able to feel like I always tell them, like, make your space that you're sitting at like your home. If you want to put some pictures and you want to, make it your own, just so that you feel comfortable working.
Yeah.
But yeah, really, really proud of our culture here. I will say this. I think it's very important that you can control what you can. Don't dwell on too much of what you can't control, but
That's important.
Yeah.
And I mean, in any service-based business, right? Like you can help those who want to be helped, do your best. But at the end of the day, there are going to be some things and some people that are just a challenge, and you can't take it personally.
Nope. And that's the other thing is I'm a very big stickler on, I do not like drama fueled environments. I don't have time for it. That's not why we're here. Luckily I have the owners and the other physicians here that are we're here for one reason and one reason only. And so I really think that communicating that and really having those open lines of communication with the staff create that comfortable culture environment where they feel that they've got an issue, they could just come straight to me or any of the other managers here.
And that's not always common. And I do think it comes from the personality of the leader and the leaders. So down, to Jennifer and the owners and the physicians and the whole team, and also to yourself. So what I'm hearing is obviously having some sort of personal connection, whatever that means for you and each individual staff member, making people feel like they're part of the team, reminding people like at the core of this, we're seeing patients and we're trying to impact their patient lives or your patient lives. And then really just giving an open door policy type of environment where it both ways, when you have an issue or when they have an issue, you can freely talk about those without anybody getting upset or feeling like it's personal, which I think right there is like the core of really any team. I don't think that's different than in a different type of business. Maybe the patient part or the why piece. But I think people in general, when they go to work in a doctor's office, deep down, depending on the person, maybe really deep or somewhere higher up, but that's why they chose to go work in patient care. Nowadays with Amazon and, the pay or whatever you can get in tech, I think you do have to really want to be in a patient-centered business. And so making sure that aligns with the employees, because you can go work at Amazon for whatever, I don't even know their pay structure these days, but you can go work somewhere else and maybe it's a different role, but it may be, not as stressful at times. So I think I truly believe like people who seek out a job in a healthcare environment are doing it because it's a passion-driven desire to work in healthcare. All right. So I've got a question for you. I think, what are some of the biggest challenges you face from a day-to-day perspective running a practice? Because I think for some of our practices, they have rock star managers and it's amazing. Some are small enough to where they just haven't been able to afford, or that's not where they're choosing to spend their money just because they're on the smaller side. And so talk to me a little bit about those big challenges that you face day to day. Is it staffing, scheduling, patient flows? Like, what does that look like? And how do you keep the team grounded, not frustrated, and kind of focused to solve those?
So, I mean, we went through recently, we've gone through some staffing changes. We were on a really good streak for a long time, about a year and a half of a full staff, no one leaving. Things happen. And so we just actually went through staffing. We are back to hire, full-time, full staff. But yeah, it is challenging because, I don't have a pool of people to choose from. I don't have a PRN on the side group, like a corporate office does. So believe it or not, I've taken on roles.
You're the PRN.
I'm the PRN. I've taken on roles that my front desk staff do, and my clinical manager, my front desk supervisor, we have all added to our schedule loads just to make sure that the other front desk medical receptionists are not overloaded. You have to, and honestly, I'm so thankful that my managers are like, I'll do it, give it to me. And because they know we're helping the patients. That's what's important. Those things can't fall, all while still trying to find someone that really wants to work and be a dedicated employee. So I think that that is really
If you need to
helped.
if you need to tell them to go away, you can.
It's okay.
Okay.
Yeah. So, I mean, it's really been a challenge for us, really the staffing. And it's really hard to find good people. It's really, really hard. I always say, I think COVID just ruined us. And, I'm not saying that like working from home is bad or remote. What I'm saying is I think it has created a lazy generation that, even just resumes that I get, I'm like, really? Really? I have a note to my kid's teacher. I mean, have a little bit more pride in what you're doing.
Yeah. Resumes actually, it still is that front door to a company. I mean,
Yes.
it's
Yes.
not organized, well written. I'm the same way. I'm like, really? Like, I can't even follow this. I mean, and nowadays with ChatGPT or whatever, I feel like you can take a resume, plop it into something and go improve this. And actually, I am starting to see resumes that have that like ChatGPT look,
Yeah.
I'm okay with it. Like, at least they've taken the initiative to clean it up.
Check your spelling.
Check your spelling. Like, in today's world, spelling should be the least of your worries. And if you can reformat in the ChatGPT world or whatever AI tool you're using, I mean, and you can do that free.
Yeah, absolutely. So yeah, I think it's just really trying to, we found some really good ones. I will say they are the two that we have now. They're newer, but they're amazing. They are doing such a great job. But yeah, I mean, really, for me personally, challenges are constant changes with insurances, making sure you have the most up-to-date information. I've just gone through credentialing hell, as I call it. And I don't have a background in credentialing. Doesn't mean I try to defeat myself from getting all the knowledge that I can, but that's really challenging to try to keep up with changes for the insurances and also working our EMR, making sure that we're coding and things like that. But no, I mean, that to me is the biggest thing, is just really getting someone in that's steady, cares about their field, and then to them, they really want to be here. You have some that just don't even show up for an interview.
I know, it's just crazy. And I do agree with you. Like, I think things have changed. I mean, so I do think having people who are willing to work in an office every single day, there's just less of that. I feel like people are like, oh, I can just go on YouTube and be the whomever is the star and make money. And hey, there is a market for that. So, I mean, good on you if that's you.
Absolutely.
It is hard to find really good mission-driven people. And again, I think one of the things that's so different about this space is in healthcare, you're not getting a raise every year. I don't mean you personally. I mean, the practice is not getting a raise every year, right? Unless you're producing more volume. I mean, yes, you can renegotiate rates and there's some ability to do that, but it's not like in a regular non-healthcare business where you say, okay, I'm going to raise prices 5% this year because we all get the emails of, oh, we're raising prices this year because of inflation. We just don't have in a healthcare business have that option. And even negotiation of contracts, you'd be lucky to get 1 or 2%, let alone 5%. I mean, you see some companies doing much more than that. And so to stay competitive with wages makes it difficult. I mean, you're either having to grow more, essentially, produce more volume, or you can't stay competitive in the marketplace. Would you agree with that? Or how have you guys kind of stayed competitive?
Absolutely. I mean, like you said, you can only do so much with fee schedules. You can only negotiate. And even, it takes forever to just negotiate. It's a back and forth, and it's just a headache to really get paid even a little bit of what you're, these patient or, the providers are doing the work, and then you see what comes back and it's like, this is ridiculous.
Yes.
But from an HR standpoint, it's very difficult. I mean, our insurance rates alone for healthcare, to offer that to our employees, 60% up. And it's just crazy to us because we want to be able to offer great benefits. Private practice, it's a dying breed. And I really think that is why the private practices are not able to do it successfully. I mean, that's one reason why we have Jennifer and Jimmy, who are so great at knowing what this practice needs, what this practice can afford, that is really challenging too, even when we're talking about hiring somebody.
Yeah.
The biggest thing for me is, they can go down the street to a corporation, get maybe a higher pay rate, but they're going to lose that one-on-one connection.
Mm-hmm.
They're going to lose the ability to have a schedule that works for them.
Mm-hmm.
I always say I have 3 kids. I always say I traded my sanity when I left one job, my past job, and came to this one. It wasn't for higher pay. It was a straight lateral transfer. I didn't try to negotiate that because I wanted to be able to have my career and have my life, my family. And I had lost that for so long. So everything in private primary care is factored into when it comes to finances.
Mm-hmm.
Every time we have it, and if there's a day where we have patient rooms that aren't filled, that is a missed opportunity for revenue.
Mm-hmm.
But it's not just revenue. It's a missed opportunity for us to be able to thrive successfully, provide extra bonuses for staff, lunches, staff awards, all those kinds of things, putting that money back in their pockets, putting that money back in a profit sharing for those employees. So it's very important that our clinics stay full, that we're always thinking about that factor of, and really Jimmy has taught me that
yeah.
When you put all the numbers out, if you have empty patient rooms, you have room to make revenue. You have more room to see more patients. And really, that is the main thing that is the driver for us to be successful. Some practices cannot do it. And that's why they just bend the knee and then they go to a corporation. And their biggest complaint after doing that is, you know what? I don't have one-on-one with my patients anymore.
Mm-hmm.
Like, I feel like this is like all about numbers now. This is all about money. I can't really practice how I want to practice. And so we don't want to get ever to that point. And so that's really why we've created the environment that we have and the drive to just keep on doing what we're doing.
And is everybody, kind of to that filling the patient rooms, is everybody, front desk, yourself, involved in filling those patient rooms, calling patients, saying that you've got appointments that we haven't seen you in a year, it's time? Like, how do you manage that piece?
So most of our patients, they're seen every 3, 6 yearly. We're also a part of Allidaid, which is an ACO. We have work lists that we work to identify those patients, uncontrolled blood pressure, our Medicare wellness is really important for our Medicare patients to get in every year. Most of them have chronic issues, so we already see them more than once. But yeah, if we have a patient that calls and cancels an appointment, we don't just cancel it off. We're sending a message and we're doing follow-up because even if we have to leave a voicemail, we also have had to, unfortunately, because patients these days just no show, no call. And we can have 4 to 5 in a day. You multiply that by 5 days in clinic, that's 20 patients.
Right.
So, that's 20 people that we could have seen. And so we have had to enact a no-show policy, no-show fee. We go one step further. If they've got that no-show fee on that chart, they have to pay that before they can make another appointment. We really do use, and I have personally used the going out to dinner or the groceries analogy. You can't go to the store and pile up your cart and just walk out like, I can't pay. It's the same thing with healthcare, and really too, educating our patients about their deductibles, their balances, their co-pays, why their insurance is denying it. A lot of patients have no idea what their insurance entails.
And do you give them a script or a pamphlet? I know we did pamphlets a few years ago, but what are you doing today?
So typically, if they're at a stopping point with the front desk, we'll communicate that back to Michelle, or I'll talk to them and kind of walk them through their bill. No, but we have signage. Copays are due at the time of service. If you have a deductible, be ready to get a bill for it.
And do you do a deposit for deductibles? We've got some practices starting to do like just a small flat fee for deposits.
We don't, not for the insurance plans. I would like to look into something like that for the future. Like I said, we just got our front desk back, so I'm hoping that maybe we can start doing that collection. We do for our self-pay patients.
And self-pay, pay full and time. What we're seeing with some practices that they're doing, and we're seeing this even from primary care to like subspecialty, surgeries or whatever, like we're seeing the whole gamut where they're actually doing if they have a deductible, right? They will do a deposit, essentially $50, $75, depending on kind of what's going on with the practice and what kind of visit you're doing. But they'll say, okay, it's a $50, $75 deposit, and they'll collect that deposit. It sits unposted. Now, the only risk around this is we have some practices who are really good with refunds and some practices that are really not good with refunds. And so obviously, if by the time a claim is submitted and if other claims have been submitted, that deductible may be zero at that time, and you may owe a patient a refund. If you like, one of our new softwares that I love is ModMed, Modernizing Medicine. It is a beautiful software, and they have a refund button. You just push it, and it's like refund, and it refunds the patient back to the credit card that they put it on, sends them an email. It is, I did a webinar for the EMR because I love the feature so much. Yeah. I know it's silly, but it just, because how much time do you spend on refunds? Like, I mean, not, if you got them.
Yes. I mean, we do try to identify the refunds for the patients. I will say that our out of network policy has really, really helped.
Yes.
Enacting those payment plans, the recurring payment plans has really, really helped.
Yep.
It's really actually, and we've had people default on them. We've had people, and unfortunately they get educated and then they're like, oh, I better not do that, or, and the thing I love about our office is I am more than happy to work with a patient that has a balance. If you're working with us and you are aware of it and you are doing everything as a patient, that you can do to make right your balance, I'm going to meet you with that same energy. We're not going to deny anybody care, but in healthcare, there has to come a point because we lose money. Mm-hmm. Every medical facility loses money when they provide free care. And essentially that is what it is. And it's not just a runny nose. It's somebody, who has really serious chronic issues. And so that's really something that we have tried very, very hard on the front end to make sure that we are collecting those balances. I will say the staff here, any other office I've ever worked at, I rarely have to be like, why wasn't that balance collected? They are very, very good. They've got their screen, as I call it, their, start over here and end over there. They go from left to right to make sure that we are not missing anything. And they're also not afraid to say, you know what? I don't know why you have a balance. Let me go ask my office manager. She's going to explain it better. But yeah, I mean, and I know the economy is bad. I'm well aware of that. But you have to remain diligent. You have to remain strong on your front end, that you have to collect those copays. You have to pay those. That is your agreement with your insurance. That is not your agreement with our office. I had a patient actually tell me yesterday, well, why did your office charge me a deductible? And I said, well, we didn't charge you a deductible. You haven't met your deductible, and you're going to need to call your insurance about that because you have a contract with them that says you're going to pay this amount and then they're going to kick it in. And he's like, I didn't know that. And I'm like, oh, well,
it's
rough.
But I think, so what I think your office has done well, and I've got one more eligibility question because it's like the hot topic of everything, but I think what your office has done well is even in the face of turnover, even in the face of staffing changes, you train them. Like, it's not magical that the front desk people show up and know how to collect balances.
Yep.
You've trained them how to do that. You've told them what to do. Do you write scripts or anything for them, or do you just kind of do that on an as you go training?
They do have some scripts. I was told at a very, very long time ago, probably years ago, that if you're trying to collect money from a patient, you don't say, would you like to take care of your balance today? You say, you have a $20 balance. We take cash, check, or credit card. You don't ever ask them. One, already know. Everyone knows. Unless your house burned down and your address is wiped from the earth, you get a statement. You know if you have a balance. So I think really the sternness and and really being aware of that patient's account that's in front of you. You have a balance. It's due today. How would you like to pay is the only question that you should ask. So I think getting them to, and we not only do that with not just with our financial verbiage, it also is put into appointments and hospital follow-ups. Can't capture those TCMs if we're saying to the patient, do you need to follow up with that? No, Miss Jennifer got a notification. You went to the ER. She wants you to follow up in office. We can get you in today, tomorrow, those kinds of things.
Yeah. It's not a question. It's this is what is needed for the practice, for your health, for your XYZ, and this is what's happening.
And they can say, no, I'm good, or I'm going to follow up with specialty. But I really think it's the tonnage, the verbiage, the way you present it to the patient, that this is what we're doing. This is what we need from you, and not really giving them any kind of wiggle room for that.
Yeah, this is not optional. All right. So one thing, we've been billing for your practice for 3.5 years, I think now, something like that, 2022. And eligibility is always the fun topic. And
yes.
I just feel, I feel bad for practices. I feel bad for front office staff, because I feel like in this ever-changing rule between COB, coordination of benefits, through eligibility checks, and an easy way to do that, which there isn't a great way to do this. It's a pain in the rear end, no matter what you do. Like, how do you work with your staff on those eligibility expectations? Because I know you hate when we ping you about eligibility, and we hate having to do it. And so it's like, how do you manage that? Because your office in general, like of all of our offices, you guys do a great job with this. We've had some hiccups as you had new staff, and then you worked through those. But like, how do you handle that? Because it's a pain.
So it is a load. You can't, we see, each of our providers sees about 20 patients a day. We tops have 4 providers in office. So every day, that's every day. So you can't do them a week in advance. They have to be done daily, 1 to 2 days, and they have to be worked every day. What Kristen has really, really done that has helped the front. So there is a sheet that they have every day of assigning who is in charge of what. So for example, my front desk person from 8 to 11, she's working only on new patients. My other person during that time, she's on verifications. But in the afternoon, that verification load goes to my other person. So they have specific duties so that we can ensure that every item that has to be done by them is being worked on, not by the same person, but every day, so that they can't get off task. They know if they're doing verifications and the phone rings and they pick it up and they answer it, they help the patient, they put it down, they go right back to verifications.
So they're focused.
And verifications doesn't give you a green check mark that says patient's active. You have to look at what type of plan. Do we even accept that plan? You have to see what network are they in, PPO, HMO. What is their copay for our office? Do they have a deductible? Have they met their deductible? Then you have to go all the way down to the bottom and find out if their Medicare ID number is different, or if they have another X in front of their Blue Cross and Blue Shield number. So they know every single, and all of these steps are taught to them so that it's ingrained in their brain to just boom, 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 and they know what to do. Now, we do have some payers that we don't have the ability to verify them electronically. So those take a little bit of time. But I will say for our office, doing all of the electronic ones first that we can verify very quickly, that's the bulk of our payers. That's the bulk of our schedule. The off-the-wall, Meritain, Health, and ABS, things like that we can't, those take a little bit more time. But once again, even the information that we can't do electronically, we're transferring in manually. And I really, really think that before I got here and before we started doing verifications, we have dramatically seen a less amount of issues insurance-wise. I don't have a lot of reaching out saying, hey, this is,
No.
But I really think it starts with educating the front desk. For example, if we get a new insurance card that starts populating beginning of the year, or we know of a new plan, the minute we get that card, we're making copies. We're blacking out patient names. If it's one we can't take, we're like, nope, put this on your no fly zone. We cannot.
Oh, that's a
see
good idea.
so that they can physically see, because you can sit there all day and tell them the name of an insurance that just populated. They're not going to know that. So, but also how to enter in a TRICARE. I mean, I know TRICARE IDs have gone back and forth.
Yeah.
One day it's the DOD number. One day it's the social. One day, I mean, they go back and forth. Even knowing how to load a Medicare patient's plan, that red, white, and blue card, what items come secondary to that, not replacement plans. That's a big kicker to know that, we have a lot of patients who will hand us everything. They hand their red, white, and blue, but they've got Florida Blue Medicare, which takes the place of it. So really educating staff and having those pictures to show them, no, if a patient hands you this, it goes this way. This is the way you put it in. And so really that's helped them to understand, but it changes all the time. So you really can just give them, and I think for us, for the verifications, we've also started calling our patients that have inactive insurance when we are verifying it prior to them coming in. We're not waiting for them to show up at the front desk. We are calling them, reaching out, saying, you have an appointment tomorrow. I need your insurance card, pictures of it. You can email it to me. We have a texting feature, but we have to have that before you step in office, because if we can't verify it, we won't be able to see you that day. And that's really
huge. Right. I mean, this whole process is huge because it is in depth.
It's a game changer.
And it is from a denial perspective, right? Like you guys have some of the lowest denials, I think, of any of our just like less than 1%. I mean, it's crazy low. Now, primary care in general, if there's denials, it's typically either a major coding issue or eligibility. Eligibility 9 times out of 10 is the main issue we have with any of our practices. And yours just, again, in the grand scheme of things, you guys have an extremely well-oiled machine when it comes to eligibility.
Well, we've really taken it serious from the things that you guys have pointed out. I mean, I want to know if my staff's doing something wrong. That's the only way you learn. If you're doing it wrong and you're not being told it's wrong,
right? You
gotta tell somebody, because we're just going to keep doing it wrong. And so I really think that feedback alone is, and I came into, I'm going to be very honest with you, I came into a billing nightmare.
You did. We did too.
We were on that journey together.
We were on that journey together. Yes, we were.
But I will say, I have learned so much more than if I wouldn't have gone through that billing nightmare, I probably wouldn't have learned as much as I have. And I would not be able to do any of the things that I do and be able to educate staff about this. And the main thing for me is, I've really tried to drill into the front desk, is what happens in the front affects the back. It affects every single part of it. It affects if that patient can get that medication. It affects their prescription benefits. When it comes to the providers, it affects the way they have to code something. Mm-hmm. And it's not just the insurance part, it's how you schedule something. You can't schedule a preventative annual for a 69-year-old male. That's a Medicare wellness visit because it's going to deny. It's really about, if you get it right on the front end, you have a less headache on the back end. And I always tell them, what happens in the front affects the back, but what happens in the back also affects the front. Mm-hmm. We used to have a culture where just grab the patient, just go ahead and pull them back. And I'm like, no, ma'am, we have these little buttons and they're in progress. So while the front desk is doing what they need to do, they're in progress. The back staff can see that. When they are done, they change to in, which means you can come grab that patient. And so, nobody wants to leave their desk to run back and get an insurance card when we've already taken a blood pressure and done vitals.
No, especially when that defeats the whole purpose of, okay, so now if you do need to collect a copay and have that conversation and they're sitting there with a blood pressure cuff or in a gown and then you're in this whole awkward situation, and then you miss your opportunity, because if there is a balance or if there is an issue, and then you're already seeing the patient, what are you going to do? Not see them at that point? No, that's.
And once those patients are in that situation, they're looking for every exit door to not walk by your front desk.
Right.
It just happens. It is. I mean, it's just, and I've even gone as far too as trying to educate our medical assistants. This is how you can tell if a patient has a balance. If you get in there and that patient starts talking about all this kind of stuff, kind of take a minute and look back and be like, oh, okay, well, this is why you were told this, but let me let you talk to somebody. I don't want you to let them leave here because they're not going to answer that phone when I call or when our front desk is calling. We want to get resolution, but we also want to make sure that our patients are educated that this is what our practice expects. And some people are on board. Patients love it. They're like, wow, you tell me more than my insurance companies told me. But that's building a trust factor. Mm-hmm. They're understanding that they're not just a number to us. We really do value them, but just trying to get them, keep that well-oiled machine. If you think it's going to all happen without any kind of issue, then you don't need to work in health. Find another job.
I do think it's having that expertise. It's setting the right culture. It's training. It's communication, which we've all touched on today. And that makes your office a joy to work with. And those billing moments we had in the past when we first took on the account, so glad that those are no longer there and that we're in a better spot. Those first few months there were difficult, just, the vendor and everything. Like that was not fun. But we got through it. And now I feel like you guys are rocking and rolling. And it's just been great to work with you guys. Your entire office is easy to work with, organized. When we've got an issue and when you've got an issue, like it's just like, okay, come to the table. Let's fix this.
Yeah, absolutely.
It's been great to work with you guys. Well, thank you for your time today, sharing kind of all of these little nuggets I think are really important for other offices who may not have this all down yet. I think it's inspirational to hear from other offices that it can be done. Yep. And it is possible. I love it. Well, thank you very much for being on today. And I hope you have a good rest of your week.
Yeah, thank you so much. I appreciate it. Thanks for asking me.
Okay. And then for the listeners, of course, if you liked this episode, please share it with another practice or physicians in your life who are maybe struggling with some of these issues. So thanks so much for being on, and we'll talk to you next week.